Chapter 25 looks at diseases of the circulatory and lymphatic systems. In this chapter, we cover a variety of bacterial, viral, and protozoan illnesses. So to start here, looking at some terminology, bacteremia, of course, referring to bacteria in the blood, septicemia, referring to bacteria that are actively reproducing or actively dividing as they're traveling through the bloodstream. Viremia is when we have the presence of viruses in the blood, and toxemia is toxins that are spread through the blood. We have SIRS, which is a systemic inflammatory response syndrome. This is an inflammatory response due to the microbes or toxins in the blood. Essentially what happens is the immune system goes into overdrive, and the inflammatory response is actually more severe than the infection itself. This is what happens or what we're seeing in some people with COVID, that their immune system launches such a massive response that it's not really the virus itself that's doing the damage, it's our own immune system trying to protect us from the infection is actually doing more damage. And we'll see that as we go through some of these, we'll see this inflammatory response syndrome is really causing a lot of trouble. Sepsis is kind of the first part of this SIRS response. This is triggered by the production of excess cytokines, which are cell mediators that help jumpstart the inflammatory response. And in localized infections, these are a good thing. These cytokines bring extra white blood cells to the area, bring, the repair cells. And so the triggering of the inflammatory response is a good thing. It does, alert us that something's wrong. And it also helps ramp up the immune system. However, if this continues and the immune response really ramps up and we get too many cytokines and too many of these inflammatory mediators that are coursing throughout the bloodstream, now the inflammatory response is disproportionate to the infection itself. And so the heart rate goes up, respiratory rates go up. And if the person is not treated properly and effectively and quickly, then patients with sepsis can go into septic shock and eventually die. Now, of course, included with the cardiovascular system, we have the heart, and we can have several different conditions that affect the heart. We can have endocarditis, which is the inflammation of the endocardium, the inner lining of the heart. Pericarditis is inflammation of the pericardium, which is the outer sac that surrounds the heart. And then myocardium, or the myocarditis, is inflammation of the heart's muscle, which is referred to as the myocardium. Vasculitis is inflammation of blood vessels. Then we'll discuss a couple of different conditions that cause petechial hemorrhaging or petechiae, which are in response to damaged blood vessels. It looks like a rash on the surface, but if you look a little closer, you'll notice that it's not a rash. You are actually seeing blood that's pooling underneath the surface of the skin due to these damaged blood vessels. And petechiae can lead to ischemia, which is reduced blood flow to the tissues. If we damage the integrity of blood vessels, then we are interfering with blood being able to reach, particularly the extremities, is where we really see the effect of ischemia. As we look at the lymphatic system, we'll have a couple of different conditions we look at. Lymphangitis is inflammation of lymphatic vessels, and this can produce streaking under the skin. A bubo is a swollen lymph node. We have collections of lymph nodes in different areas throughout the body. We have a collection in the neck referred to as the cervical lymph nodes. We have a collection under the arms, the axillary lymph nodes. We also have a collection in the groin region referred to as the inguinal lymph nodes. So we have large collections of lymph nodes there. And then we have others kind of scattered throughout the body. Lymphadenitis is the condition of having swollen lymph nodes. So a swollen lymph node itself is called a bubo. The condition of having buboes is called lymphadenitis. So now let's actually get into some of our conditions. And I've already talked a little bit about septic shock. And again, this is due to that overwhelming inflammatory response. The most common bacterial infection leading to sepsis is bacterial pneumonia. And then you see they're followed by intra-abdominal and UTIs. So we look here, we have toxic shock syndrome, which is caused by Staphylococcus aureus that produces a particular superantigen, which is a type of toxin called TSST1. And this is a very sudden onset. And what you're seeing here in this image is the rash that's associated with this. And it's really not a rash so much as the skin is actually peeling off here. This is petechial hemorrhaging that you're seeing here, blood pooling underneath the skin, and you can see how loose the skin is here, this blistering here, and the skin will peel off. This is also going to involve, you see there are 3 or more organ systems, so it could involve the kidneys, the lungs, the liver, about a 3% fatality rate. Fortunately, this really isn't something that we see as much anymore. We had kind of an outbreak back in the 80s due to a particular brand of super absorbent tampons. And what happens is if a tampon is left in too long, it sets up really the perfect environment for bacteria to grow. And so those that were affected were younger to middle-aged women who were using this particular brand of tampon. And that's why now there is that warning or the little notice that comes in all boxes of tampons that warn women not to leave them in too long, because it can set up the growth of bacteria, not just Staphylococcus aureus, but really any type of bacteria. Now, Streptococcus pyogenes can produce a very similar condition, and we call this streptococcal toxic shock-like syndrome, so STSS. More severe than the regular staphylococcal toxic shock syndrome, can develop bacteremia, develop necrotizing fasciitis. They can develop ARDS, which starts to interfere with breathing. And you see there's a much higher mortality rate. And this usually develops when someone already has a streptococcal infection like cellulitis or pyoderma, pyomyositis, or they already have necrotizing fasciitis. So this is something that we have to look for in an individual who might have some type of superficial Streptococcus pyogenes infection. So puerperal sepsis or childbed fever, we got introduced to this with our friend Ignaz Semmelweis that we looked at way back in Unit 1, that he was trying to figure out, why the women were dying. And what he found out, of course, is that people weren't washing their hands and they were transferring these bacteria to the women. Can lead to peritonitis, septicemia, and death. And of course, using antibiotics and practicing proper hygiene, proper hand washing techniques. You see there it counts for about 15% of all maternal deaths. And so, you know, not as much something we have to worry about in the United States. This is more seen in other parts of the world. So infectious arthritis, characterized by inflammation of joint tissues. And you're thinking, well, what in the world does this have to do with the cardiovascular system? Well, usually with infectious arthritis, the bacteria has gotten into the blood. So we've had a, you know, situation of bacteremia, and the bacteria go to the joints and they settle out in the joints and lead to this arthritis. And that's why we refer to it as infectious arthritis. Maybe acute or chronic, and typically it can be treated with antibiotics, but depending on what is causing the original infection, you see their prognosis is often poor. About 40% of those with non-gonococcal infectious arthritis suffer permanent joint damage. So by the time it gets to this infectious arthritis stage, the infection has been ongoing for quite some time. And so it's a lot more difficult to treat at that point. So looking at acute infectious arthritis, we get a rapid onset. Swelling may occur after joint replacement surgery. Staph aureus or Neisseria gonorrhea can cause this. Chronic infectious arthritis, more likely to occur in patients with other illnesses because they're already predisposed, their immune system is already weakened. Maybe little or no pain, comes on gradually. Osteomyelitis is inflammation of bone tissue, again caused by infection. You see there most of the time it's Staph aureus, but it can be, you know, Streptococcus pyogenes or Pseudomonas aeruginosa. In adults can gain direct access, but in children, it's often due to bacteremia spreading from a focal infection. Treated with IV antibiotics, may involve surgery to remove the affected tissue before it spreads further. Gas gangrene caused by Clostridium perfringens. Clostridium perfringens is just a nasty little bug. It can cause some pretty violent food intoxication. It produces 11 different toxins that we know of. Intense pain, swelling, and necrosis are going to occur, and the bacteria are going to get into the bloodstream. Shock, kidney failure, and death follow. And really, it's just cleaning the wound. Proper cleaning of the wound is what's important here. Here you can see some damage done to this individual's leg here, some type of wound they had here, and this is gas gangrene. These blisters that you see here, these are essentially pockets of gas that are produced by the bacteria filled with blood and pus. Probably going to lose this leg because you see how much it's already covered across his leg here. Next, we have tularemia, sometimes called rabbit fever. The interesting thing about tularemia is that the infectious dose is very low, as few as 10. Can be fatal, but very rarely fatal. Can be inhaled or through the bite of an infected animal, or tick or deer fly, which is usually the case. Fortunately, we don't see as many cases of tularemia anymore, but the majority of the cases do occur in Arkansas just because we have rabbits and we have the ticks that are known to spread the disease. Brucellosis is sometimes called undulant fever because there's this relapsing fever that can become, if it's untreated, can become this chronic condition where a person will feel good, and then they'll have days where they'll have these flu-like signs and symptoms with a high fever, and then the immune system will kind of counteract it, and then they'll feel better, then the fever and the flu-like symptoms will occur again. Fortunately, we don't see this in the United States nearly as much as we used to because of cattle vaccination. Those who work with cattle or hogs were most at risk for this, but due to vaccination, again, something we don't see very often. Cat scratch disease can come from cat scratches and bites. Fever and malaise, localized swelling, and then this is going to involve the lymph nodes. You'll notice here in this image, here is where the initial wound is, and you can tell the area is kind of swollen and red. But if you look right here in the neck, you see these swollen lymph nodes here, several swollen lymph nodes in the cervical region. Now, keep in mind that cats can carry many more diseases than just this one. Cats can carry staph and strep and all kinds of nasty bacteria in their mouths and on their claws, particularly if they're outside cats. So anytime you get a wound from a cat or a dog, for that matter, very important to wash the area thoroughly and watch for any signs of infection. Something that you learn about in the history books, bubonic plague, transmitted by an infected rat flea. The vector here, called the rat flea, but feeds indiscriminately, can feed on any type of mammal really, because plague, you see there, can be carried in over 200 different species of mammals. Bubonic plague takes its name from those swollen lymph nodes called buboes. If it's untreated, then it can result in bacteremia, where the bacteria, of course, get into the bloodstream. That can lead to hemorrhage and tissue death, especially among the extremities. Mortality rate in untreated cases is over 50%. And you think, well, this is something that, you know, is old, it's been around for a long time, we don't have to worry about it anymore, which really isn't the case. We do still have cases of plague in the United States. Looking at diagnosis for the plague, we look for the bacterium in the bloodstream, and it takes this safety pin appearance. So here you've got red blood cells, you've got some white blood cells, then you notice this little cluster of bacteria here, so much smaller than our cells, but they have this kind of safety pin appearance that you can see there. Here is the Xenococcus, the rat flea that is the vector for plague. Here's a picture of a bubo, so a very swollen axillary lymph node. Now, these are cumulative cases from 1970 through 2018. You can see most of the cases are centered in the Four Corners region. What we have discovered now in the United States is that prairie dogs have become one of the main mammal hosts. And so the fleas feed on the prairie dogs, and then they bite humans and transmit the disease to humans. So it is still around. It is still something that we have to look for and have to pay attention to. But fortunately, due to modern medicine and our antibiotics, don't typically have to worry about it becoming septicemic or even the pneumonic form that can cause pneumonia. So you see here cases and deaths. So we don't have that many cases each year, and deaths very few. Pneumonic plague is when septicemia occurs and the bacteria settle out in the lungs. Now, This becomes dangerous, and this is what happened in history when we would see these huge outbreaks of plague that would kill hundreds of thousands of people, is once the bacterium gets into the lungs, then it can be spread person to person. It can be spread by droplet transmission through coughing and saliva. The disease develops very rapidly, and you see there, if it's not treated, death occurs in pretty much 100% of cases. Septicemic plague, also considered to be 100% fatal. Here is a disseminated hemorrhage. So this would be like a petechial hemorrhage. So you see on the surface, it kind of looks like a rash, but if we were to look closer, these are actually little pools of blood underneath the surface of the skin. And bubonic plague has its nickname Black Death. So essentially what happens is the damage to the blood vessels will continue, and this will lead to ischemia. And so what happens is this tissue here becomes necrotic because it's not getting blood flow. If it's not getting blood flow, then that means it's not getting oxygen. And so this would have to be amputated. So a couple of tick-borne diseases we're going to look at here, anaplasmosis and airlichiosis. They're very similar. They used to actually kind of all be grouped together. Anaplasmosis spread by ixodes. And what you're going to notice with these different tick-borne diseases is that a lot of them are going to be treated by doxycycline or tetracycline. These are very effective against these obligate intracellular parasites, which a lot of the tick-borne diseases are. Here is a white blood cell that has been infected with anaplasma. Like I mentioned, they are obligate intracellular parasites. They do get into the white blood cells. We are seeing more and more cases of anaplasmosis, probably because we're more aware of it now than we were, is a big part of it, but also because we continue to encroach on tick territory. You know, as we continue to tear down forests or cut down forests and build homes, we encroach upon the territory where ticks live. We're going to continue to see a rise in cases of tick-borne diseases. Anaplasmosis is typically found in the upper Midwest, or most cases in the upper Midwest, and then also in the Northeast. And a couple of images here of the black-legged tick or deer ticks. There's more information about these in your walkthrough of the lab. So airlichiosis, again, very closely related to anaplasmosis, transmitted by the black-legged tick, Ixodes scapularis, as well as the Lone Star tick, also an obligate intracellular parasite, also treated with doxycycline and tetracycline. They infect white blood cells. You see this looks very similar to the infected white blood cell of anaplasma. Seeing more cases of this, not as many as we do with anaplasmosis, about half as many cases, but again, still on the rise. And this one is particularly concerning for us because we do see higher case rates. In fact, this particular bacterium was first isolated from a soldier at Fort Chaffee in Fort Smith, or near Fort Smith, and that's where it takes its name, Ehrlichia chaffensis. So we do have higher case rates of this particular tick-borne disease. Epidemic typhus, not something we really have to worry about. In the United States, it is a rickettsial disease, and you'll see this pop up several times, but it's spread by the human body louse. And with, proper hygiene, people really aren't spreading lice to one another, which means they're not spreading disease. But during World War I and even going into World War II, we had a real problem with epidemic typhus because our soldiers would be crammed in these battlefields, and of course they weren't taking showers, they didn't have proper hygiene, and so the lice would just spread among them. You see there, it killed more than 3 million people on the Eastern Front, and it does have a pretty high mortality rate in untreated cases. Another type of typhus is called endemic or murine typhus. This is flea-borne typhus, spread by our friend the rat flea, the same one that spreads plague. Most cases of murine typhus in the United States occur in Texas, California, and Hawaii, so pretty warm areas. Can be serious in those who are immunocompromised, but fortunately something that we don't really have to worry about too much. Now, one we do have to worry about is Rocky Mountain spotted fever. This is another rickettsial disease. They are obligate intracellular parasites. 90% of patients exhibit a characteristic rash, and that's where it takes its name, Rocky Mountain spotted fever. It's kind of a misnomer. You see Rocky Mountain there, you think, oh, well, this occurs over out west, Colorado, Utah area. Unfortunately, that is not the case. That is where it was discovered, but not the case. You see there, we are in its prevalent states. Here is a chicken embryo cell showing how it lives inside the cells. We've never been able to culture this in a pure culture because it is an obligate intracellular parasite. Here are infected tick cells. This is one that can be transmitted vertically. So if the mother is infected, the mother tick infected, then she can pass this bacterium on through her eggs. And so each successive generation could already be infected with the rickettsia pathogen. In our area, primarily transmitted by the Dermacentor ticks, either dog ticks or wood ticks. And here is a picture of the rash. It's very diffuse. The little spots are very close together. This can be petechial hemorrhaging. This one continuing to go up. Again, we're encroaching on tick territory. And so you see we're right in that area. This was in 2019. So we did have quite a few cases that year. You'll notice a lot of this data is a couple of years behind, and that's because it does take a long time to verify all of these disease reports from the CDC, which is where I take all of this information. Another tick-borne disease is Lyme disease, and this is spread by ticks of the genus Ixodes. What's different about Lyme disease is that the tick must remain on the host for at least 48 hours. It takes a really long time for enough of the pathogen to get into the system to cause disease. The characteristic hallmark of Lyme disease is this bullseye rash, which we'll see on about 3/4 of patients. The third phase of this, though, involves severe arthritis. So if someone isn't treated in the first stage, then it can become chronic and lead to a type of infectious arthritis, which is not treatable. Here is an actual infection of the myocardium. So not just joints, but actually getting into the cardiac tissue. This is the characteristic bullseye rash. So the tick bite would be right here in the middle. We'd have a very red area surrounding that, and then an area that's not red, and then another red area so that it kind of looks like a bullseye. Now, fortunately, this is not something we have to worry about as much here. We do have the pathogen here. We do have these types of ticks here, but we mostly see this in the upper Midwest and in the Northeast. Kind of mirrors the distribution pattern of anaplasmosis. Another tick-borne disease is called Tbrf, or tick-borne relapsing fever. The individual will have a high fever, about 3 days, and then about a week without fever, then another 3 days of fever. And without treatment, this will continue. This cycle will continue several times. And this is due to those antigenic shifts. Remember, changing its coat. The pathogen, in essence, hides from the immune system. Endemic in the Western United States. What's different about this one is it's spread by soft ticks. Okay, so not the hard ticks, but the soft ticks. It's another form of Borrelia, so very closely related to the causative agent of Lyme disease. And so this is what it would look like in a blood smear. They are spirochetes. So you've got these little spiral bacteria in amongst the red blood cells here. And here is an image of the soft tick ornithodoros here. You can see what it looks like before and then after feeding. So it becomes very engorged there. Again, this is something that's endemic out west. Don't really have to worry about it here. And we don't see all that many cases. I mean, you see here in the span of, what, 20 years, we really don't see that many cases. And in fact, when I went to try to get some updated data, there isn't any. It stops at 2011. Trench fever, again, transmitted by the human body louse. And this, of course, is in areas where there is lack of hygiene or people in very crowded conditions. Again, something that we saw in World War I. Now getting into our viral infections of the cardiovascular and lymphatic system. First up is mononucleosis, which is caused by the Epstein-Barr virus, which you see here, HHV4. This is a herpes virus. Herpes viruses remain latent in the body. So once you are infected with a herpes virus, it never leaves you. It's always there. So this one we commonly call mono. It does spread through saliva, and so sometimes it gets the nickname the kissing disease because it does replicate in salivary glands. It takes a long time for it to start to produce signs and symptoms. Really, fatigue is the biggest one here, and this can last for 4 to 6 weeks. You know, kids that it's very common in teenagers, and when they get this, they may miss, 2 or 3 weeks of school because they're running fever and they're just exhausted. They have absolutely no energy, and there really is no treatment other than the relief of symptoms. So, ibuprofen and Tylenol to help treat the body aches and fever. A complication of Epstein-Barr infection is called Burkitt Lymphoma. And this is a type of non-Hodgkin's lymphoma that forms in people who have malaria or HIV. So they're already immunocompromised and they become infected with EBV, and it produces these tumors essentially that are cancerous. And we first saw this in Africa, and it is more common in Africa where we do have co-infection with HIV, malaria, and Epstein-Barr, and it's primarily a disease of children. And so this is what the tumor would look like in a child with Burkitt lymphoma. It can be treated, and it can be treated successfully, but often in areas where we see this, these children don't have access to good medical care. Another type of herpes virus is called Cytomegalovirus. It is a lytic virus, and it causes these cytopathic effects, meaning we can look at the cells and see that they've been infected with cytomegalovirus. Most people, if they are healthy, are asymptomatic. They'll get exposed and never even know it. I mean, you see there 50% of the adult population in the United States is infected, and most never know that they're infected. However, fetuses, newborns, and those who are immunodeficient, can develop severe problems. Symptoms are very similar to mono, without the fatigue. Really no way to prevent it. There is treatment, but really you just treat the symptoms. Here are cells that are infected with cytomegalovirus, and sometimes these are referred to as owl's eye cells. Here's a really good figure here showing this kind of halo around those inclusions to kind of make it look like owl's eyes. So I'm not going to show these videos. You can watch these on your own, but they just kind of go through the history of yellow fever. Before the 1900s, thousands and thousands of people died in the United States due to yellow fever. And, you know, we couldn't figure out what was causing yellow fever, where it was coming from. The last outbreak in the United States was over 100 years ago. By that point, we kind of knew what was causing it and how it was transmitted. Walter Reed is credited with discovering the transmission of yellow fever. He figured out that it was mosquitoes that were carrying yellow fever. And this was the first time that we really saw a disease that affected everyone equally. You know, a lot of these diseases that we talk about affected the poor more than they affected those who were affluent or wealthy. And so they were often considered, you know, a disease of poor people, but yellow fever wasn't like that. It was very indiscriminate. It affected everyone equally. And that was because it was due to a, you know, it was transmitted by mosquitoes. So it's transmitted by the Aedes aegypti. It's called yellow fever because it infects the liver and causes severe jaundice. And the individual actually starts to turn yellow. The whites of their eyes turn yellow. Their skin starts to turn yellow. There is no treatment for yellow fever. There is a vaccine, but it's not that great. And individuals can develop symptoms of yellow fever after receiving the vaccine. So here is the Aedes aegypti mosquito. And of course, the mosquito does live here. We do have Aedes mosquitoes living in the United States. However, yellow fever is no longer endemic in the United States. It is still around in areas of Africa and South America. And if you go around through Texas, Arkansas, Mississippi, Louisiana, you'll see these yellow fever cemeteries. And you'll know that they're yellow fever cemeteries because you'll see that the dates of death are all within 1 or 2 weeks of one another. And that would signify when yellow fever would sweep through the town. So I'm going to stop there before we get to dengue fever so that this video isn't super long, and I'll pick back up with a part 2.